All right. Hi, everybody. This is Foley Vision Center calling out to all of our wonderful Foley Vision Center patients. This is Breast Cancer Awareness Month, the month of October. Yay! And so we're here to remind everybody how important it is to take care of yourself, not only outside, but inside too. So we want to just do that shout out to all of our lovely lady patients that please take care of yourself and take advantage. If you haven't had a mammogram, please go out and do so. Remember, it's recommended for 40 and older, and unfortunately, I am definitely past the 40 mark at this point in time. So we're doing our part. And we've got our wonderful Amy ready to go with our fabulous Marina, who is our patient, and she's just having this wonderful, nice time to relax because she had to get up early to pitch hit for us this morning. We have our fabulous Gabby, our advanced laser esthetician here, who's going to be talking about microneedling and radio frequency. And then, of course, to save to the end, to the bitter end, we have Miss Stevie, everyone knows, is the mostest. She's going to be handing out the prizes and going over what we're going to be doing. So please stay to the end because we've got some fabulous prizes from this. So this is a wonderful presentation Gabby's going to be giving, and I'm going to be pitch hitting a little bit. But basically, I'm going to let Gabby talk about what we're talking about this month, which is microneedling and radio frequency together. It's a power combination, and it's fabulous for improving structure function of the eyes, and that's what we're all about here to help with ocular surface dry eye. But I'm going to let Gabby take it away. All right, Gabby.
All right. Can everyone see this? Okay, I know we had some technical difficulties last go around, so you just let me know if anything's going haywire. So yeah, microneedling and radio frequency together, it's actually a really common treatment that people stack together. The reason that we do that is because they both help produce collagen. They kind of just have two different indications for them. One is more for those kind of deeper set wrinkles, any acne scarring, things like that. While the other is going to go a little bit deeper. It's going to help activate those fibroblasts and get some more collagen pumping that way. So they're a power couple. You can see them like that. So traditionally radio frequency, that's what we've always used here. And this, of course, is probably, if I had to pick, it's like picking your favorite daughter. She's probably my favorite because she also has more benefits with dry eye as well. Radio frequency works by getting those cells oscillating. So think about dancing cells, and that's what causes the heat. So it's not actually from the pen going around your eye. It's not the pen causing that heat. It's your cells activating, going around and moving, and that's what causes that heat. That cell action is what causes the fibroblasts to activate, which causes that tightening effect from that collagen and elastin. Next, we have microneedling, which for us, we use the Skinpen device, which is the first FDA approved device. So of course I'm biased, but this one's my favorite. Basically microneedling, think about it as a kinder to your face tattoo pen. You know, it's little tiny needles that are just going to cause a little bit of injury. And everyone's always so scared when they hear injury, but that triggers that skin repair response. That think about when, you know, it would kind of trigger those stem cells to come. So think about when you're younger, you skid your knee, within a few days, it's already healed. And now if you skid your knee, it's going to be a few weeks before it heals. It triggers that healing response that made it only take a few days to heal. So we're going to help stimulate that collagen elastin that we used to always be producing, where now by age 20, you are decreasing by 1% at least a year collagen elastin. So we're playing catch up. I'm doing all the things already. And I have people say, why are you doing that? Because I'm losing it already. I'm going crazy. It's terrifying. So why would we stack these? Again, they kind of do the same thing, just in different ways. So it's kind of like doing a skin tightening treatment on steroids. So you get the tightening from the radio frequency. You are also smoothing out fine lines with that radio frequency. Plus you get the beauty of it is helping to express those glands, which is really nice. Then we have the microneedling, which is also, it kind of does a skin tightening effect, but it's more about causing that collagen elastin to kind of thicken up and toughen up that skin. which thick skin is really great. That's why like men biologically have thicker skin. That's why it's so annoying, because they'll sometimes age better and use like Dawn dish soap on their face. You're like, why the heck do they look better than me? It's because they literally have thicker skin that is going to wrinkle less. So microneedling helps to thicken that skin up, induce that collagen. Combining the two, you get basically both benefits in one treatment. And it's kind of, honestly, it's mostly a time saver as well. So not only do they kind of work together to get a little boost, but then you just have to come in once and you get best of both worlds. And again, why is it superior? You cover more indications than just one or the other alone. As well as microneedling helps thicken up the skin here as well. So it's going to make it harder for any rosacea, things like that, to come up to the surface. So there is also a little bit of a dry eye component that you can look at with the microneedling as well. Like we said, easiest little presentation ever. Now we get to go to the fun part with the demo.
Yeah, thank you so much, Gabby. That was great. I always learn something new. Again, the reason we are putting these combinations together is we want to restore that structure function of the upper and lower lids, because as we get older, that upper lid gets more loose and floppy. And so now you're not getting a clean closure when you're sleeping. You get those air gaps, and then that puffiness that happens with loss of collagen and elastin pulls that lower lid down, which further causes problems. So we're going to swing over to Amy and spotlight this. You guys can watch as she's doing the radio frequency treatment. And then we're going to have Gabby show you what we would do after the radio frequency treatment with the Skinpen microneedling. All right, so basically we start off with radio frequency at a certain frequency that's based on your skin type and your age. And you can go a little bit heavier. Marina has some beautiful skin there around her eyes, so we can go a little bit higher energy. What energy are you at right now, Amy?
25.
Yeah, this is the new IMV handpiece that we're using, which was we helped in development. And it's able to get into the nooks and crannies much better around the orbit. So we do stay on the orbital bone right now, because that helps conduct the radio frequency waves. Again, just like a sound wave, it's got that sinal rhythm to it. And by causing impedance with the bone, it helps to get those radio frequency waves deep into the dermal tissue. But you have to be well hydrated. As you can see at the top of her the hand wand, it has that little blinking there for a second. That means the skin wasn't in temperature. Now it is. So we need the patients nice and warm and cozy. So we've got Marina with a beautiful, thick, heavy blanket here on, and that's keeping her toasty warm. So that allows Amy to get through. And about 5 minutes per eye is basically the treatment. And is Marina falling asleep on you, Amy?
Yes, she is. She's very, very, very relaxed.
It is just the most relaxing, fabulous treatment on the planet, like a hot stone massage around your eyes. But it's heating and getting those fibroblasts excited, like Gabby was explaining. In addition, it's going to get those oil glands pumping, because we're right where the oil glands reside in the lid. And so for today's purposes, we're not going to be yanking and pulling the lids up and down, where we go a little more aggressively on and over those glands. Here we're doing it kind of a more relaxed feel, just to help with that basic skin tightening around the orbital bone. So she's going up and around the orbital bone. It's a little hard to see on the superior side because her hand kind of blocks it just a bit, but we're going all the way around. And we do this for a full 5 minutes. And then after we are done with this, then that's where we can go to doing the microneedling, and we can anesthetize that area a little bit. And that's what we're going to have Gabby talking about. So Terry has a question. Dr. Foley, is the treatment frequency for ocular conditions or medical improvement different than treatment frequency for cosmetics? That's a really great question, Terry. Basically, what we've found over the last 4.5 years or so is they're pretty close to the same. Ocular treatments, as we know, when it comes to radio frequency, it's based on your age. So if you're 40, you're going to need at least 4 treatments spaced about 3 weeks apart. And if you're 50, you're going to need 5. 60, you're going to need 6. When it comes to cosmesis, we might be able to get away with a little bit less, but that's where having the consultation before we get started with Gabby is so huge, because she can really help us in deciding if we're going just for cosmesis, we have a great ocular surface, we may not need as many treatments. So Gabby and I both work together on that. How would you say that, Gabby? Do you think that's on
Yeah,
par?
I mean, I'd normally follow the 1 treatment per decade. That being said, I see some people where I just look at them and I'm like, oh my gosh, your lid structure is amazing. And where they might need less. Or I see some people where, like me, myself, I have hooded eyes where I know in the future it's going to be an issue for me. I've accepted it. There's a lot of loosey-goosey skin. I know for me, if and when I need these treatments for OSD, I'm gonna need more. And so it kind of just definitely depends on the person. And then the treatment area as well depends on if you're just looking at the eyes for skin tightening for cosmetic reasons, or if we're talking about like, oh, I have some looseness in the cheeks, in the jowls areas that I want to treat. Something like this, where there is more tissue to heat up, can take a little bit more treatments than the thinner skin around the eyes. So that's also something to keep in mind, where something like the jowl area will be more of a 6 to 8 treatment thing regardless. Whereas the forehead, if it's nothing too crazy, that can be a little bit easier just because it is less tissue.
Great. Well, that's awesome. Thank you, Gabby. That really helps kind of clear that up. I think we have a couple more. So that was the radio frequency around the eye. And then another question is, can you stagger the radio frequency and microneedling treatments without losing benefits of both? Or do you need to combine both treatments at the same time?
You can.
Yeah, I'll let you take that away there, Gabby.
So I totally took over it. It cut out where
okay.
we answered at the same time. You can stagger. It's more of, you have the option that you can stack them. But you can totally stagger them, whether you want to do a whole series of radio frequency, then a whole series of microneedling, or if you want to have radio frequency, microneedling back and forth. You're still going to get the benefits. It depends what you're going for. If you're going for just general anti-aging, or if you have some acne scarring or what, there would be different things I'd recommend depending on what it is for the person. But you do not have to do them on the same day if you don't want to.
Perfect. That sounds great. For those of you probably don't know, but Marina already had the other eye done. So now she's complete. She's had 5 minutes per eye. Can someone who uses retinol, can they do this? Yes, you can do the radio frequency. How about the microneedling, Gabby?
Yeah, with retinol, with tretinoin, you can have microneedling done. It is just something that I want to know about if you're using it, because it might change how aggressively I treat you. Just because oftentimes with retinol, it can kind of make that epidermis, or that upper layer, a little bit thinner while thickening the dermis. So you just want to keep that in mind, that I can do what would normally be a more gentle treatment that is going to be a little bit stronger on someone with tretinoin or retinol.
Okay, sounds great. Well, do you want to go over the Skinpen now, the microneedling aspect? So what would happen next after the radio frequency treatment?
Normally, Amy is going to do radio frequency on the right eye. And after she's done with that, she's going to put some numbing on there. So if we're doing a full face, same idea. She would start with the forehead, slap some numbing on, so that we can have less time in between. So we're not having you here for like 3 hours, right? So we would kind of, as we go, slap some numbing on, so that we can make the microneedling more comfortable. But basically, so Amy does the right eye, slap some numbing on. She does the left eye, slap some numbing on. Then I steal you away, and I will start with the first side, the right eye. Realistically, the numbing only needs 10 to 15 minutes. I like to give it the full 15 just because maybe it's placebo effect, maybe it actually works better. But 10, 15 minutes. And then when we look at microneedling in general, we have a glide solution that kind of, think of it where it just lets it glide around the face a little bit easier versus going on there dry and kind of dragging needles on there. So we have a glide solution that normally contains hyaluronic acid. The one that we have with Skinpen, so we have the FDA approved Skinpen with their FDA approved glide, has hyaluronic acid as well as peptides. So that gives us even kind of more benefits with it, which is really great. When we are just looking at the eye treatment area, I kind of like to say that we are looking around this orbital area. So kind of right through here is where I like to treat. I like to get anywhere where there could be this little smile lines. Some people like them. So I always ask them, like, do you like those? Do you want to keep them, or do they bother you? So we get right through here and about, I would say, a 1/4 inch away from the lash line, and you pull that skin down while you treat, because you want to treat on top of this bone. So it's kind of an awkward treatment, treating around the eyes, I'm not going to lie to you, and it's kind of freaky because this will sound kind of like a tattoo gun. So it's loud, it kind of vibrates. It's mostly the sound that's kind of bothersome. As far as sensation, you're so numbed up that you're going to feel a little bit of pressure. Otherwise, nothing too crazy. We go pretty gentle in this under eye area because it does have that thinner skin. And we just, the longest part, honestly, is we do one pass through there, and we have to wait a little bit because around the eyes, especially in this area right here, it's going to have a delayed redness. So I'll be chatting you up. Well, you know, I'm waiting for that first pass to kind of get a little pink, and we'll keep on doing more passes until I see what I'm looking for, which is just kind of a flushing. We can also find a little bit of pinpoint bleeding, which is technically not necessary for clinical endpoint. You are still going to get really good results with just that general flushing, because this has a whole bunch of needles going into the skin repeatedly, where you're going to get really good results from just that kind of injury triggering collagen. Why people do this around the eyes: helps build that collagen. Also, dark circles. So if you have, you know, you started to get where you just have this loss of collagen, where, of course, my dark circles look really amazing in this lighting, but it can help to fill in that area. I will say some people just genetically have really, like, even though they have that fatty tissue there, they kind of just have dark circles. So if it's more from they have the kind of pocketing, then that is something that could help with microneedling. If you are against using things around the eyes like filler, which me personally, I would never want to put filler around my eyes. I'm okay with it for the lips, not around the eyes personally. So it kind of gives you an alternative to help build up the tissue around there.
All right, that sounds great. And I totally agree with you, Gabby. We're concerned about too much excessive filler in the what's called the tear trough area, because that can kind of mess with the structural integrity of the blink. So anything like that that you're trying or thinking about wanting to do, please ask us so we can advise, because not all injectors are aware of these things. In fact, I spend most of my time now actually lecturing to plastic surgeons and injectors on this specific topic, so that we're all in this together to make sure things are safe. Well, gosh, ladies, thank you so much. That was wonderful. And at some point, we'll wake Marina up and let her just rest a little bit longer. We're all a little envious of her right now. Stevie, it's your turn, woman. Ta-da.
I have a quick question for Gabby real quick before we continue on. Just a second. Hey, sorry. Somebody's talking. I'm like, I can't hear anything. So I've never had microneedling done. I want to do it, but I don't know, how long does your face stay numb?
Oh, I mean, you will, by the time you get home, you're going to feel a little bit of that heat from the microneedling. It's really nothing too crazy.
Okay.
Like, you mostly just feel it when it's actually happening. As far as being sore afterwards or anything like that,
Right.
like, you can tell something was done to your face, but see how I am. So you're not supposed to touch your face for 4 hours. So like, I have bangs, I have all these things where I'm more panicked the whole time about not touching my face and having my hair off my face. I'm always thinking more about that than, oh my gosh, my face hurts. So
It really does feel like, because I've had it before, it really does feel like almost like the tightening, like you can literally feel the tightening of your skin. And it's almost like you've had a really bad sunburn, but that feeling doesn't last very long at all.
it is just like a little hot. Yeah.
Yeah.
Well,
And
I
then
can
the
handle
skin
that.
feels a little bit tight the next couple of days. But otherwise, like, I think after, and this is going to sound bad because IPL is my girl, I think after IPL hurts more than microneedling.
Oh, I totally agree with that. 100% I agree with that.
and I love IPL so much, but I think it's harder aftercare, other than I'm such a face toucher, and I know I'm not supposed to, but I'm a face toucher, and that's where I have a hard part of and I have
think that's
dogs
all of
and
us.
everything else, and you have to change your
Wow.
pillowcase, and so that's where I struggle the most. That's why if I always say that 1540 and microneedling are kind of like cousins. 1540 would be my choice, even though it's a bit
Got
more
it.
painful during and after. It's kind of easier aftercare. So
Yep.
kind of, it's one of those things where some people are like, I want the one that's easier sensation wise, and they'll choose microneedling. I would rather have more pain during treatment and have an easier time just being able to touch my face. So,
Okay, so I can confess that on fractional, which is 1540, I can go without numbing.
and you are
And
a crazy lady.
I am
can't believe it.
weird that way. Yeah. But when it comes to, I don't know about the microneedling, but yeah, it's always so
You want
interesting.
numbing.
You want numbing. Yeah, I'll say I did 1540 on my hand on Friday because I have a scar here that I'm like, oh, I want to get rid of it. And oh my goodness, I was shaking while doing it. Like, it was so bad, but that's fine. No numbing.
Oh, wow, go you. All right. Well, I think we're at that point where we want to wrap things up for everyone because we know you have a short lunch and we want to be respectful of your time. We appreciate all of you folks tuning in today because this is always so much fun. We have such a great time doing this. Again, remember, Breast Cancer Awareness Month. So we
And
won't bug
remember,
you.
early detection saves lives.
Yes, big time. We know that well here in our practice. So Stevie, da-da-da-da.
Okay, let's see. Okay, so
Downtown.
today we're gonna be giving away one eyes only microneedling and one eyes only radio frequency. So you'll see, so you'll see what it's like. There we go. So the first one,
right.
let's do radio frequency. So that's Shauna. Shauna.
Shauna!
Shauna!
Yay, Shauna!
Hey, good job.
All right, who's gonna be my
Yay,
victim?
Shauna!
All right, microneedling
My
is
victim.
Debbie S. I know who you are.
Debbie!
Yeah,
Oh
I know,
my
I'm
I'm pretty
gosh.
sure we all know who she is.
Congrats.
Yes.
Yay!
Oh,
Yes,
we have
so
the best patients ever. We were just saying that the other day, and we are just so grateful to everybody in our community here in Eugene, Oregon. It is amazing, and we feel very, very blessed to live in such a lovely, lovely place. So thanks to all of you guys out there in the interwebs, and we'll look forward to next month. And what are we doing next month, ladies? What's our Thanksgiving month? Are we gonna have...
Were we gonna share, or are we gonna keep it a surprise for a couple weeks?
Oh, maybe we'll have to keep it a prize for once. Oh, yes.
I am gonna
Terry?
say you guys are gonna want to be there.
Yes. We'll be sending out some feelers here. But one thing, Terry, our loyal patient, did remind us all about the annular eclipse that's coming October 14th. Eugene will represent. We'll get a better kit on it versus the solar eclipse we had back in 2018 or something like that. And we didn't get a full solar eclipse here in Eugene. They did in Corvallis, right up north of us, but we are going to have the annular eclipse. So that is Saturday, October 14th. It's going to be somewhere between 9:15 in the morning to 11:15 in the morning here in Eugene. So tune in. You can get those solar eclipse glasses at Home Depot. We've been trying to get some through our association, but there's been a shortage. So I'm trying to figure out where if I could find the ones we had from last time. You cannot use your sunglasses. They will not be adequate. And the annular eclipse is rare. We won't have another one until 2046. And that's where you see the blockage from the moon, casting the shadow on the sun, but then you see that cool corona. It looks like it's on fire. So I'm looking forward to this one. So definitely.
We're going to be right under it in Eugene. So
it'll be super cool. Super cool. So get up and, do your thing on Saturday the 14th and be safe, people. Okay?
Wear your sunscreen
Right.
still.
And just
Yeah.
remember not to do those contacts for Halloween. You need to be
No.
fitted for contacts.
Good point.
Save your
Yes.
eyes.
Yes, save on those beautiful eyes of yours. All right. Have a
Bye,
marvelous
everybody.
week. Take care.